the small town of Bryan, Ohio, a community hospital barely survives. At the same time, the people it serves struggle to stay healthy as good paying jobs disappear. Brian Alexander's new book, The Hospital: Life, Death, and Dollars in a Small American Town, takes a deep look at what's broken in the healthcare system. The contributing writer for The Atlantic makes a complex story understandable while showing us the very real effects of inequality on the people of the town.
Americans die earlier, Americans live less healthy lives, and yet we pay far more for healthcare in this country than anybody else does. We are doing it wrong.
In a deeply compassionate work of investigative journalism, Alexander reveals how the business of healthcare fails so many Americans. Alexander, thank you so much for being with us to talk about your new book, The Hospital: Life, Death, and Dollars in a Small American Town.
Thank you for having me. I wish I could be there in person, but we're all Zooming these days, and so it's still a great pleasure.
It is. You set your book in the small town, 8,500 people or so, of Bryan, Ohio. It's based on the story of a hospital called Community Hospital and Wellness Centers in Bryan. What made you want to put it in that location?
Well, it was partly a coincidence. I have been a contributing writer for The Atlantic, and I did a story about the perilous financial situation of many small community hospitals all over the United States. As part of that story, I interviewed a fellow by the name of Phil Ennin, who was the CEO of CHWC, Community Hospitals and Wellness Centers in Bryan. The story came out and Phil called me back and he said, if you want to do a deeper dive into how we are managing to keep our doors open, you should come to Bryan and I'll let you, be in the hospital and have a look. So I did. I took him up on that offer. I thought to myself, once I was there, that there was a much bigger story here than just about one hospital in one town. And there was a bigger story even than about the American healthcare system. It was a story about how our economic system, especially over the last 30, 40 years, has affected the health of Americans and the lives of Americans. And I could tell that story through the lens of this one hospital. Phil agreed to that and we were off to the races.
Yeah, you take a deep dive into what goes on in this particular hospital, but I was struck by the fact that it could have been anywhere.
That's the point of it. It could have been 300 other towns all over the United States, especially in the center part of the US, parts of the South, places that often have been left behind by economic and social developments since about 1980. They have suffered a great deal. And as a result, the people there are suffering a great deal.
We're in St. Louis. We come to you from St. Louis, and I know it could have been any number of Missouri towns.
Absolutely. I mean, I've had the good fortune to take a rather extended motorcycle trip through Missouri, and there are a lot of towns like Bryan all over Missouri.
And what's happened to our towns here and what happened in Bryan is over the course of time is that big manufacturing left. And so there just are not the jobs anymore.
Right. Manufacturing has really undergone a revolution. And you could use terms like blame, for example. There's a lot of blame to go around. Both political parties have their share of blame in this. We made a choice as a country, whether we were conscious of making the choice or not, that we wanted to live in a globalized, free trade, financialized economy. The town of Bryan, even though it's a very rural area and there's a lot of farmland around it, in Williams County, which is where Bryan is the county seat, its economy is really based on small manufacturing, tier 1, tier 2 auto suppliers. In other words, they make a metal part or a piece of injection molded plastic and they sell that to Detroit or to Toledo, where Jeeps are made. And that's the basis of their economy. 2008, 2009, the unemployment rate in Williams County was over 17%. That's almost Great Depression levels. And a lot of jobs that paid $21, $22, $23 an hour, they went away and they have not come back. Unemployment is actually very low in Williams County, but the jobs that people have now pay $11, $12, $13 an hour.
Your book has a cast of characters. It's not just a, sort of dive into the research about the hospital, but there's a whole cast of characters that humanize this story so much. I wondered if we could talk about them a little. Like I was just thinking about the person, Keith, the man named Keith, who worked at Menards.
Right. Keith worked in auto-related manufacturing, lost his job in the Great Recession, managed to get another job, a relatively decent job, got married, had a baby. His wife, unfortunately, had a very serious medical problem. I don't want to give too much away, but Keith ended up working at Menards for $14.50 an hour. And the policy there is that you've got to be there 90 days before you can sign on to health insurance. And once you do sign on to health insurance, deductibles can be as much as $5,000. And it's expensive. The employee's contribution is quite expensive. And this has a cascade of effects on Keith and on Keith's family. It's not so much that Keith, who was diagnosed with diabetes, is unique. Keith is not unique. In this country, many people with diabetes are rationing their insulin. They're not taking their insulin because they can't afford it. And there is a series of consequences that results when you do not address your diabetes properly. People are literally stuck between the choices of going broke or dying in this country. And Keith is faced with those choices.
What are the root causes of that, do you think, that people have to go without insulin, for example?
Well, one root cause is greed. I think a lot of people don't realize that when insulin was first isolated in the 1920s by two Canadian researchers, they sold their rights to that for $1 because they believed that this was for the benefit of mankind. Now, here we are 100 years later, and diabetics are paying as much as $1,200 a month to try to buy their own insulin. It does not have to be that way, and it should not be that way. Not only the insulin, you have, diabetes is an interesting case because it does show the power of what I call the medical industrial complex. If you're a diabetic, you are now plugged into a whole host of diabetic test strips, equipment. You are and you can live a very long life. So you are now going to be spending a lot of money for the rest of your life on an awful lot of products.
There's another person in your cast of characters named Valerie, who was working several jobs just to be able to, keep her head above water.
Right. Valerie was working 3 jobs when I first met her. She was full-time at a furniture manufacturing company where she worked the third shift. Third shift is the overnight shift. Then she would leave that job and work as a school bus monitor in the mornings when the kids were going to school. Leave that job, go home for a few hours of sleep, then go to her other job of being a caretaker for an elderly gentleman. She was helping his wife, and then go do the afternoon shift on the school bus and then head toward the furniture factory. She said that she got probably 4 or 5 hours of sleep a night. If it was a really good night, she'd get 5 hours. And she was married. Her husband also had a full-time job. Together, their combined income, which does not include all the deductions from their pay, was about $45,000 a year. They had 2 kids. That's hard.
Mm-hmm.
That's hard to do that. So she would pick up, she in the book, she talks about how, she delivered pizzas for a little while. She would mow people's lawns. She was not afraid of hard work, but she was not. She was barely keeping her head above water with all that. And a lot of people live that way.
They do, which in the context of, a story of a book about a hospital and medical care, they're just like one step away from complete financial ruin if they don't have a better
That's
income
right.
or
When I
somebody
first met
providing.
Valerie, I asked her how much she had in the checking account. She had $65, and that had to last her for another couple of weeks. So she was, as I say in the book, she was one dead car battery away from being broke.
Hmm. Yeah, $65 doesn't go very far, certainly with
No.
anything medical, right?
But the important point of this is, uh, I asked her, I said, do you and your family see doctors on a regular basis? And she laughed out loud. She said, no, we've got to be dying before we see a doctor. And unfortunately, in Williams County, as is true in many, many places, people are quite literally dying before they see a doctor because they're not getting any kind of preventive care.
The residents of the town at one point called the hospital the BandAid Hospital. Why did they call it that?
Well, if you're familiar with small towns, and I grew up in a small town in Ohio, so I know this quite well. Um, when an outsider is talking about the town or comes to the town, people are full of local pride and they do not want any outsider to insult their community. But when it's among themselves, they figure that something like a hospital that has organically grown up in the town cannot possibly be as good as some big city hospital someplace. So they call this hospital a Band-Aid station. In fact, the Bryan Hospital really is quite advanced for a community hospital of its size. And that is a conscious business decision on the part of the hospital. Phil Ennin realized that if they were going to keep the doors open, they needed to keep people local for their care. And the way to do that in an environment in which big organizations were sending people to specialists all the time was to recruit specialists of his own. So they had a special women's clinic with OBGYNs, they had a special pain clinic, they had a special wound care clinic, a special gastrointestinal clinic. They had what's called a cath lab for heart catheterizations. And really surprisingly, they had a radiation oncology center, which is very unusual for a community of this size. So Phil paid top dollar to recruit people to staff these specialty clinics, and people did begin to stay local for their care.
And what was the effect of that on the hospital itself?
Well, the Radiation Oncology Center is a profit center for the hospital, so that's a net profit making opportunity there. The OBGYN was new when I was there; it was not yet in the black, but they anticipated that it would become in the black. Same with the GI center. So what happens when you have these specialty clinics is they also spin off a fair number of tests and so on. So you do the testing, you do the blood work, et cetera. You can charge for all that and get reimbursed for all that. This is how the business of American healthcare works. And why the hospital serves as a really good microcosm. They were trying to stay in business. A lot of big health systems are trying to really earn big profits. They don't call it a profit because they are officially, quote, non-profit hospitals. But in reality, what they like to call operating surpluses are simply profits. And some of these make 16, 20, 25%. One hospital in Indiana made a 49% profit margin as a quote unquote non-profit hospital.
You talk a little bit about the danger of, like, in a town like Bryan, or maybe a city like St. Louis or a Missouri town or almost anywhere, of the hospital becoming the biggest corporation that there is or company that there is. What's the danger of that?
Well, I mean, you may see it there. I don't know if Ascension is the biggest employer in St. Louis, but I'm willing to bet you it's one of the biggest employers in that area. It's a giant health system. Um, what happens is in Bryan, as I said before, it was mainly manufacturing. The hospital is now the largest employer. When you're kind of barely making a margin, and in 2018, they lost money every single month, and your largest employer is in that position, then the linchpin of your local economy is at risk of going under. If that goes under, what happens to your town? Um, Another problem is more political. In Bryan, as is true in many other places, hospital is the largest employer, and 2/3 of its income comes from the federal government in the form of Medicaid and Medicare. And yet, people often vote against things like Medicaid and Medicare. They often have deep suspicion of the federal government. In Williams County was like 68% or something like that for Donald Trump in the 2020 election. So they wanted to starve the very source of income for their largest employer.
It's such a well-researched book. It's amazing. It's just a great work of journalism. And just hearing you talk about it, I can see how deep your understanding is of this.
Well, thank you. I mean, it was 3 years in the making, and I basically did nothing else for 3 years. I moved to the town, bought an old used car there. Thank you for saying that. It's a lot of work.
And I wanted to ask you at some point as well about the access that you had, to the town. So maybe we should talk about that now, since you say you moved there.
I felt it was important that I maintain a physical presence in Bryan as much as possible. I think I know small communities pretty well. And one thing, especially in recent years, as we have had this political debate and division that small communities really resent, are people just sort of popping in and making all sorts of statements about the people who live there and their town, and then popping back out again. I felt that if I was going to ask people to invest in me and trust me and tell me their stories, I had to be there. I had to be in the taverns, in the restaurants. I had to be in the hospital. I sat in the ER at least 3 or 4 days a week. I went to church services. I had to be as much a part of the community as I could be.
And that's one thing that is so great about the book. And I want people to know that it is a really human story. I can tell you really like the people of this town, and you really show us them in so many dimensions. None of these people are one dimensional.
Yeah, and thank you. Yeah, I like small towns. They're small towns, especially small towns in the Midwest and areas that voted for Donald Trump, are often stereotyped. Sometimes the stereotypes are true. I mean, there's a strong anti-vaccine movement in Williams County, which is very unfortunate at the moment. Uh, so there are these issues. I'm not saying they don't exist, but people are more complicated than an easy two-line throwaway in a paragraph. They have lives that they lead, and they have reasons for holding the beliefs that they hold, even if I happen to disagree with them. I also really like small towns. As I say, I grew up in a small town. I really enjoyed growing up in a small town. I've lived in big cities ever since, but I never really lost that love for them. And I like working as a journalist in a small town. I've spent the last 6 years or so writing about really. I see a serious American pathology. I believe we're in trouble. We're in trouble for a number of reasons. Some of them are obvious, some of them not so obvious. And it's not so obvious to most people what forces are leading to this trouble. I'm trying to get to the bottom of something. It's hard to do that because things are complicated. In the case of Glass House, it had to do with private equity investors and financial manipulation and so on. And that gets complicated. I would read these SEC reports and I'd get a headache because it's mind numbing. The medical care system in this country is outrageously complicated. I'm convinced that nobody really understands how it works because, in effect, as one character in the book says, there is no system. And so something that I have really developed as kind of a mantra in my head is who benefits from the complexity? Because where there is this enormous complexity, somebody has figured out how to make a lot of money. And they have a vested interest in keeping it complex. But this complexity also crushes other people who are on the outside, people who need access to medical care, people who need good food, healthy food, and can't get it easily. Why do some of our cities like Jackson, Mississippi, why do they not have decent water in the 21st century? What has happened to some of our great manufacturers and who's behind that? Um, I'm trying to get at this foundation. Um, that's just very important to me. Whether or not I try to make it an interesting read, people judge whether it is or isn't interesting, but it's just important to me to do it.
Well, it is really interesting. And this complexity, speaking of complexity, has the Affordable Care Act helped any of this that you see?
Yes. There's a good chance that the hospital in Bryan, Ohio would have closed without the Affordable Care Act because many more people could afford health insurance with their subsidies, especially in a community like Bryan and surrounding Williams County, where people are barely keeping their heads above water. So the ACA helped them a lot. It increased the number of insured people. And so people started going to doctors again. Then the hospital gets to send those bills out and they get reimbursed for that. So that helped a lot. I happen to believe that the ACA is not the final answer. It's a good thing, but it is not the solution. I did not go into the book necessarily feeling that we needed a national health plan. I do now. I really feel like we should blow the whole thing up, start over again with a national health plan. Other countries do this. Our peer nations of wealthy industrial Western nations, they have figured out how to give people health care. Why do we not? We pay far more per capita than any other nation on the face of the planet for medical care, and we get far less results. Americans die earlier, Americans live less healthy lives, and yet we pay far more for healthcare in this country than anybody else does. We are doing it wrong, and we have to admit that.
So can you elaborate on what you would like to see happen?
Well, now you're above my pay grade. There are entire think tanks who spend years saying what could happen. I can only say that whether it's a Canadian style plan, a UK style plan, a Swiss style plan, which is kind of a hybrid of insurance and government, there are models out there. I can give a couple of very concrete things that I think are obvious. And part of this comes from personal experience. So most drugs prescribed in this country are generic drugs, and they should cost practically nothing because they're generics. They're off patent, they're generics. Why can't, and we have seen this now with the COVID vaccine, why can't the federal government go into the drug business? And when drugs leave patent protection, why can't we have government manufacturers that sell the drugs for cost? In other words, it would still cost you something, but there would be no profit motive. The idea would be to break even. An example is a thyroid medication. A small thyroid medication that millions of Americans take was about $7.50 a month. Overnight, it went up to $15. It doubled in price. Now, most people can afford $15 a month, but that's not the point. The point is a 100% increase, and that a lot of that gets charged to Medicaid and Medicare. right? And there's no reason, there was no explanation for how it increased. If the government was making that drug and selling it at cost, maybe it would sell for $3.50 for a month's supply. That's easy to do. I don't understand why we don't do that.
Well, here's hoping a bunch of people in Congress read your book.
I hope so too. I
And
hope so.
yeah, I want to mention that you do talk a little bit about, what happened, where the hospital is after COVID.
Yeah,
Spoiler.
the last part of the book deals with COVID, the COVID pandemic. And it was interesting. I was writing the book when the pandemic started. And to me, it revealed, it just exploded all the fault lines that I was describing earlier in the book. Access to care, finance, all of it, inequality. It really blew it all wide open for me. In the case of CHWC, as in the case of many community hospitals, they lost $800,000 a month at the beginning of the pandemic because they had to shut down all non-emergency surgeries. So no more hip replacements, for example, which is a moneymaker for the hospital. And yet they still had to keep the physical plant going, employees going. So there's outflow. There's just not a whole lot of income. And then the CARES Act, passed by Congress, made up a lot of that loss for them, these hospitals. Now, the big health systems, they have had banner years, record profits. Lab testing companies, record profits. Insurance companies, record profits, all during a pandemic. Why is that? Well, we're all still paying our premiums for insurance, but we're not using the services. We're not getting knee replacements. We're not having, exams and lab tests. So they are not having to pay reimbursements. So they are making money hand over fist. It really shows you the perversity of this weird melange of medical healthcare we've created in this country.
Is there anything else you'd like us to know that I haven't asked you about?
Just that it's a look at a kind of an American sickness, which I don't always mean literally ill as in a medical sense, but we have become a sick country. And I try to examine the social, economic forces at play in people's lives through the lens of their health and through the lens of this particular hospital. I hope I've done a good job. I mean, readers will be the judge, but I do hope they pick it up because I think they'll learn something, and I think it might even be important.
I agree. And I hope they do too. And I want to say that, this is a really human book, and so I think there's a lot of misunderstanding between small towns and larger cities and so on. And those of us who inhabit, it's on both sides. We don't understand each other well sometimes. And this really humanizes the people in this town of Bryan, Ohio, and makes me think about people around me. So
thank you. But that's exactly what I was trying to do. So I appreciate your comment. It's gratifying.
Brian Alexander, author of The Hospital, Life, Death, and Dollars in a Small American Town. Great book. You can purchase it at Left Bank Books in person and online.